deteriorating fast, Michelle said quietly. And he is so young. As Michelle held up the patient's chest x-ray to the light box, Laura planted her stethoscope on his chest and listened. Then she straightened up and draped the instrument around her neck. "Mr. Mercer," she began, "I'm Dr. Nelson, the chief of surgery at Tampa City, and I'm a thoracic surgeon." How much of what she said could he make out with an oxygen mask covering his mouth and nose and the constant bang of the positive pressure machine? He flicked his eyes, nodded. She assessed the patient's physical appearance. Curly auburn hair with clumps sticking to his damp forehead. Thin to the point of emaciation. Lung cancer jumped to the top of her differential diagnosis. She took a moment to examine the x-ray. Definitely bilateral pneumonia. But too often she'd found tumors lurking behind the infected lung tissue, hidden from sight on the x-ray. But in someone as young as 32? "Did Dr. Kellerman tell you that he recommends a biopsy of your lungs?" A slight nod. His eyelids rose, panic flashed across the blue eyes. "I know you can't talk with the oxygen running. But as soon as I finish my examination, I'll take the mask off so we can discuss our next steps, all right?" Matthew Mercer nodded again. Despite the oxygen, his breathing was ragged and his color grayish. High-risk patient. Not too high risk for a biopsy, she hoped. And what were those raised purplish blotches on his face and neck? When she turned down the sheet to examine his chest and abdomen, something clicked, a suspicion. Red-purple lesions, some coalescing into plaques that marred his lower abdomen. Folding the sheet still lower, she saw how the lesions extended down both legs in an irregular pattern. When she checked his genitalia, she found more of the same purplish papules. Laura pointed to one of the spots. "Michelle, did Dr. Kellerman go over this finding with you on rounds? Did he order a dermatology consult?" No one talked about these sores." Michelle paused, correcting her terminology. "These lesions." Then probably no one's made the diagnosis. Yet. Laura had to check one more site, the patient's mouth. She removed his oxygen mask. Ready with a tongue blade from the bedside canister, she asked him to open his mouth. Indeed, angry-looking raised lesions peppered his gum line, some of them covered with white, cheesy material she knew was a fungal infection, candidiasis. Medical school professors loved to teach, but Laura held back. She had to be sure before she shared her clinical impression. Her presumptive diagnosis, Kaposi sarcoma, KSHV, HHV8 infection. If this was Kaposi sarcoma, then there was a reasonable possibility that this patient had AIDS. As far as she knew, AIDS had not yet hit Tampa, and she was afraid that the diagnosis would throw the hospital staff into a panic. 4 years earlier, the medical literature had reported an epidemic of Kaposi sarcoma in the homosexual population. The Centers for Disease Control and Prevention, the CDC, named it GRID, for gay-related immune deficiency. But now, a retrovirus, HIV-1, had been isolated, and the outbreak was called Acquired Immunodeficiency Syndrome, AIDS. She'd been following the controversy swirling around the discovery of the virus. Dr. Robert Gallo at the National Cancer Institute claimed to have isolated the retrovirus HTLV2. Researchers at the Pasteur Institute in France claimed to have isolated the same virus. Still a running battle, but politics, legal battles, patents, none of that had been Laura's concern. Except now, faced with an actual patient, she realized how little she or anyone knew about this aggressive virus that had now moved into the heterosexual population, and even pediatric patients. Wasn't there recently a little boy, a hemophiliac, who'd been kicked out of school after the school found out he'd acquired the virus in a blood transfusion? Rock Hudson had died of it.